thank you, everyone, for joining us this afternoon. It is barely afternoon. My name is Michael Thompson. As you probably know, partner, senior wealth advisor here at Copperleaf Financial. And my guest today is Dr. Mark Pitcher. Mark is a practicing physician at GoodHEALTH, part of Community Health, and went to medical school at the University of Rochester and did his residency at UVM and has been practicing internal medicine here in Vermont for, we were just talking, for close to 30 years. And Mark has seen lots of things, has seen the pandemic come and now progress through Vermont. And I wanted to invite him on here to help give us an update on what it's like in the healthcare community, what's it like as a practicing physician dealing with clients every day or patients every day, and what kind of messages he has to share with us about the virus, about the pandemic, and about our health, our good health in general moving forward, and how it may affect our financial plans and life in general. So Mark, thanks a million for joining me today. I appreciate your taking the time out of your busy day to jump on. I appreciate it.
Well, thank you.
You're welcome. A couple of notes. We are going to be recording this session so that if you have friends or would like to view it later, we'll be posting it on our website within about a week or so. And we've set aside 10 or 15 minutes towards the end of the session today for questions. If you have questions that you'd like to pose to Dr. Pitcher or myself, please enter them in the Q&A session down at the bottom of your screen, and we'll be going through those questions at the end. And well, I just wanted to get started and start by just talking about the vaccine, Mark, because I think that's top of everybody's mind. And can you give us an update on what you're seeing about the vaccine rollout here in Vermont, and maybe any lessons or advice about what people should be looking for or thinking about if they've gotten the vaccine or if they're getting queued up to get the vaccine?
I think we've been extremely fortunate with a pretty sound plan and a consistent plan with the vaccine rollout. Obviously, supply continues to be the utmost of people's minds, but I've been extremely encouraged related to the enthusiastic response of people wanting to get vaccinated. That's not the same in with different sectors of the industry or different sectors of the country, but particularly our first rollout within healthcare and long-term care, that the numbers in long-term care and congregate living facilities have been extremely encouraging, up into the 80-90%. Some facilities have 100% of residents or people living in the variety of what I refer to as the silver palaces, whether we're talking completely independent centers or the nursing home centers where I work in, pretty intensely. But it's been and then the staff have been pretty receptive to getting immunized, not as high. So it's been, and they've had significant availability to vaccines. I think the state did a wonderful job of getting to those people the most vulnerable, because as we've heard through the governor and Dr. Levine, is the whole goal of the vaccination program is to prevent people from dying.
Yeah.
There are people who are going to get sick from COVID, but the vast majority of young, healthy people will get sick, but they won't get severely sick. The goal is to keep people out of the hospital and keep people alive. Mm-hmm. And now that we're into the second and now third phase of registration, again, the registrations have been extremely robust and quite, I won't say quite easy to use, but there have been there's various avenues. We're now starting to see some of the commercial pharmacies, primarily Kinney's and Walgreens, come online with similar protocols that being run by the state. So just increasing the accessibility of people to get vaccinated. I've heard some stories about people getting, having to travel relatively long distances to get vaccines, and that's probably, more of a communication, or using the tool. But the vast majority of people are getting vaccinated in or near their local communities. Now, as far as the vaccine itself, we have the two double shot vaccines from Pfizer and Moderna that are pretty much the same vaccine. The first shot, have heard very little in the way of, side effects. Myself, I had a sore arm for a day. The second shot, probably a little bit more, noted for, I will say, not necessarily a side effect, but an effect where you may 24, 48 hours after the vaccine, feel under the weather a little bit, but very, very few, maybe just case reports of people who have had any kind of, more dramatic effect. I was on call this past weekend and take call for our group, and a lot of people had been vaccinated. Had a couple phone calls. People had questions about, a side effect from the vaccine, but overall extremely encouraging, very, very well tolerated. And I'm very, very impressed by the enthusiasm of, our community to get vaccinated.
Great. And pardon my, being naive about this, but I understand that your offices and the other physicians' offices aren't actually delivering the vaccine. The vaccines are being delivered through central locations around the state and things like that. Isn't that right?
Yeah, that's correct. Right now there are. I mean, there's a hospital. The hospitals have been involved in administering really to that first group, to healthcare providers. There is direct contracts with the federal government and CVS, Kinney's, and Walgreens pharmacies to get vaccine to the congregate living facilities. And the state has there now, I think they're close to 60 sites. There is some, I work for the Community Health Centers of Burlington, which is a federally qualified health center. The federal government is reaching out to FQHCs across the country, but right now Vermont's FQHCs are not part of that. So we have no vaccine. We have no ability to, get people vaccine, and we're actually waiting, sort of with a fair amount of interest on this next phase, the under 65 with qualifying medical conditions, and how is that going to be vetted to identify who has those conditions that are quote unquote qualified. And I actually was waiting to listen to see if Dr. Levine was going to have some announcement about that today, but that will be coming in the future. But right now, you can't go to your doctor's office and get a vaccine. You can't go to your doctor's office and get a note to get a vaccine. We've had some requests from people who may have dual residencies in other parts of the borders where they now open to 65 and under to validate medical history. But and most of that has to do with your place of residency, not necessarily where your deer camp is.
Yep. I want to shift gears a little bit. There are a few questions that we've been thinking about and wondering about this, and that we've been hearing on people's minds, on clients' minds. One has to do with travel, and your thoughts about travel now, travel in the future. How should people be thinking about living their normal lives, or getting out in the world? It's certainly been almost a year now where people have been locked down, and what are you hearing? What are you telling people?
Well, I think the first thing we need to think about when it comes to travel is, what are the quarantine requirements, where we're going or where we're coming back from. And as most of us will probably know, that those quarantines starting today, Tuesday today, that if you've been fully vaccinated, you are free to come and go without quarantine.
Nice. Now,
where you go to there may be quarantine restrictions. Can I go to Connecticut and see my son this weekend at Wesleyan? And I don't know. I mean, I have to look up to see what Connecticut, what's Connecticut doing today.
Right.
So there are. So can you or can you not quarantine? But mitigation is still the most important thing. Wear your mask. Don't gather in large groups, and safely travel. I strongly encourage most of my patients this winter to go to Florida. If they feel comfortable in the community, well, wherever, most of them go to Florida, or whether it was Arizona. Arizona was Tucson was a little bit sketchy there for a while.
Yeah.
But if they feel comfortable in the community where they are, they're going to be most of these individuals are much or more able to get outside, get fresh air, whether it's golfing or the bike path or biking, as opposed to being, locked inside if they're not avid skiers. And as we've seen in Vermont, the ski resorts up until last week may not have been the safest place, to
Right.
be. But it really is the mitigation, wearing your mask, washing your hands, and, really, doing the things you can to protect yourself. Going forward, I think, what we're seeing now with our ability to get vaccinated, and if those of us that have been fortunate enough to have already have our double vaccine and following the rules of the CDC of 2 weeks following your vaccine, you're free to come and go in Vermont as it is if it's been within 3 months. Now, my understanding is the CDC wants that to be 180 days, but because of possible questions of the variant, they were much more conservative to say, okay, if it's been 3 months and you need to go see mom, out of state, go see mom out of state. You don't have.
So sorry, I just wanted to jump in. And the risk there, help me understand this. If I've got the double vaccine, if I've gotten both, and my wife has gotten both, and we want to travel somewhere within the quarantine restrictions, the risk may not be so much to me or to us, but that we still have a risk of carrying it. Is that right?
That's the theory. That's the theory, because we don't know. There actually are some clinical trials that are being reported out now, particularly from Moderna, that that may not be the case. That we don't harbor the virus. And now, just this week, it was announced that Great Britain is undergoing a trial where they're taking double vaccinated patients and actually having them breathe in the virus.
Wow.
And A, are they getting sick? B, do they harbor the virus in any quantities where they can continue to shed it and be a vector for the virus? So those particular unanswered questions. The vaccine is extremely effective in preventing you from getting sick, requiring hospitalization, and dying. So you are protected. What I don't know, I still get tested every day I walk into the nursing home, is because we don't know is if I pick up the virus tonight, going to Costco, can I take it into the nursing home tomorrow? That's the unanswered question.
Yep. Interesting. And, presumably we'll get more guidance from the CDC and from this research that's ongoing to help us learn more about that.
But I think you're going to see this information come out, almost on a weekly basis, because it doesn't take, those trials in Great Britain aren't going to take that long.
I'm wondering about something else, which is over the weekend I was listening to some VPR show, I don't know what it was, and Dr. Fauci was talking about flu in Australia, sort of a lack of the flu bug actually spreading in Australia, and he anecdotally was saying he thought that was the case here, maybe the case here. It made me think about what you may be seeing as a physician in your office in terms of flu and other illnesses. Has anything changed in the last year with what people are coming into the doctor's office for, or are you perceiving anything there?
Oh, dramatically. Everybody who's listening to this, knock on wood right now. I personally have not seen one case of flu. I've usually closed down the nursing home twice by now because of influenza or RSV. I don't think, Matt, we had the little, provider group, town hall, and there wasn't anybody that was on that session that could confirm a documented case of the flu.
Wow.
I've heard spatterings here and there, but documented influenza is way down. And that, because of that, I would suspect that every flu season, particularly with their flu shot, that this is going to be, standard attire every flu season, because it has nothing to do with the vaccine. It has to do with our mitigation. It has to do with our social contact, and it has to do with wearing the mask, but it's dramatically down. And they don't necessarily go out and survey, for documented, cultured, proven flu. They do, there's a word that Dr. Levine uses, it's a current analysis or something, where flu-like illnesses that are presenting to emergency room, urgent clinics. I think we're part of that survey where they will, do a random sampling of, flu-like illnesses, and the numbers are dramatically down. I haven't written one prescription for Tamiflu yet, and I usually, It's usually you're calling me up, I got a fever of 104, a headache, and I feel like I got hit by a truck and it came on suddenly, because you want to start the antivirals for influenza within 24 hours of the onset of symptoms for them to be effective.
Huh.
It hasn't been here. Knock on wood, please.
Yeah, that is amazing. That's really amazing. The other thing that it makes me wonder about for sort of our general health is, I noticed in myself an inclination to, I'm not one to call your office very often or want to come in, kind of willy-nilly. But I had a twinge a few months ago and I thought, well, I'm not very comfortable going into the doctor's office. Maybe I should put that off. Are you noticing anything along those lines? And do you have any advice for people about any behavioral changes in terms of their own health or doctor's visits, things like that?
I think there may be some, matter of fact, we know that there's been some, degree, and I don't want to use a negative word, of self-neglect or, think that we're probably not, we're not going in for our annual physical if it was annual, or how often you want to have a physical, or may not go in for a routine diabetic check. So I think, routine visits for chronic disease or chronic illness management have been curtailed. Obviously, there's been this huge push for telehealth, and I think there clearly are some very useful encounters with telehealth, but not many. And it may be a reassuring check-in that the chest pain that you're having really isn't your heart, or that numbness you're having in your right arm really isn't a stroke. And they may be a good triage to say, yeah, get your butt in here. We need to do some work. But a lot of that's going to be for, acute symptomatic management. Mm-hmm. I think there was just something published in one, I think maybe it was the Free Press, about a increased, death rate in Vermont over the course of the last year that cannot be explained by COVID alone. Mm. There was an article written early on from a cardiothoracic surgeon in New Jersey, and I think it was probably the New York Times. It was like, where have all the heart attacks gone? The emergency rooms were filled with COVID patients, and God knows downstate in New York it was in a very, very precarious situation for a long time. But where were the heart attacks, and where were the strokes, and where are the people that are normally in the emergency room? Yep. So there was, and that has played out, I think, to a certain extent. We need to get back. I've encouraged our group. We're somewhat constrained by the number of people that can be in a closed space, right, as set forth by the Department of Health. So, we're still only at about, 60% capacity related to the number of doctors or nurse practitioners in the office at any one time, the number of patients that are scheduled in a, hour versus what it was pre-COVID. Mm-hmm. So there are some, restrictions to that. We try to make up with some of that with telehealth. And I think going forward, we have, and we're, I think as the community opens up and as the economy opens up, that so are the doctor's offices.
Mm-hmm. Mm-hmm. Good. Well, I want to remind people that if you have questions, go ahead and enter them in the Q&A section. Just push on there and type in your question. We did have a question that, rather than waiting for the end, I'll go ahead and ask it now, Mark. This person asks, I've heard that not a lot of healthcare, that not all in the healthcare industry are choosing to get the vaccine. Any thoughts on why that is, or are you experiencing or seeing that?
That's not the experience locally. I know there is a small group of very vocal medical professionals who are against the vaccine. They have had a fair amount of, publicity on social media, and there's a particular, I forget the name of the one, or, the podcast, but there is a group that, very aggressively tries to persuade people against getting vaccinated. They're not necessarily in the quote unquote anti-vaxxer, group. But there seems to be a fair amount, but again, it's a very, very small percentage. In our community, no. If you look at the licensed professionals between nurses, nurse practitioners, physician assistants, doctors, the large percentage of them are getting vaccinated. we had, you saw somewhat of a less aggressive vaccine in, sort of, ancillary healthcare providers, particularly in nursing homes and, congregate living facilities with younger people, licensed nurses assistants or just medical assistants or what have you, just, being a little bit more skeptical. But it's interesting that on second go around, a lot of those people were stepping to the plate and getting vaccinated. We probably had in our, in the nursing facility where I work at, we probably had about, half of our LNAs, licensed nursing assistants, that said, no, they didn't want to get vaccinated. But then when the second go around came, most of them stepped to the plate and got their first vaccine. And I think it was like more just, I want to say fear of the unknown.
Yeah.
And I think, just watching, yeah, it's okay. My arm's not going to fall off.
Yep.
But I mean, in our community, that the vast majority of people in the healthcare have been vaccinated. Now, there are some people who said, I'd rather that vaccine go into a more vulnerable person and given up their right to be vaccinated because they feel as though, that their risks are low. I know some physicians that have been positive that they required COVID and they chose not to get vaccinated because they really didn't need the vaccine at that time, and they chose to let somebody else get vaccinated.
Yep.
But as a not wanting to get vaccinated or not believing in the vaccine or the vaccine was bad, I haven't seen it.
Good. Well, that's positive. Thanks for sharing that. I wonder if it makes me wonder about antibodies. If you've had it or maybe suspected that you've had it, is there any way to determine if you've got antibodies and that you may have some resistance, or is that just fallacious thinking?
Well, yeah, hypothetically, it's a very good thought. As a matter of fact, the University of Maryland just published an abstract yesterday saying multiply by 5 the number of people who have had it, and then 5 times more never had it. And that was done on pooled serum samples and looking for antibodies in asymptomatic people that never knew they had COVID. And because there's some suggestion that if you had COVID, maybe you only need 1 shot, instead of 2. I mean, we're holding to the double vaccine. And right now, I think it's Great Britain, and or they want to get everybody a shot. I mean, so that's an active discussion. Is it better to give everybody 1 shot? Dr. Levine talked about that during part of his news conference's announcements this morning. So but the antibody testing, it's really not readily available. The antibodies don't stand. I mean, if you were to ask me, can I get my antibodies tested, and I sent a rec up to the hospital, they wouldn't do it. Right. They only will do antibody testing for, I think, 3 specific diagnoses and particular indication. And it has to do with one childhood illness, something to that. Hang on, let me just. Part of being on call. No, I mean being. All right, sorry about that. And so it really isn't a part of clinical practice right now.
Okay, good. Well, thanks for sharing that. Another question came in, which I think is interesting, which is how long do we know how long we might be protected from the vaccine after I've got my double shot? Do I got a year that I'm good to go, or in a month?
I'm losing you.
Oh, can you hear me? Okay. Can you hear me?
Somehow your feed is breaking up a little bit. Can you hear me?
I can hear you fine. Can you hear me now? Can you hear me now? Can you hear me now?
You're just coming and going. There you go.
Interesting. All right, you have me?
All right. It said, no, that looks better. It said your connection was disrupted.
Oh dear.
No, we don't. I mean, if the best evidence to that is the CDC saying, okay, you got 3 months to travel.
Yep. Do
it now. 3 months not to quarantine because we don't know after that. They wanted to go to a month and a half. And I think a lot of that has to do with the variant. We don't know if the 3 variants that have been identified, though the vaccines are effective against the vaccines that we're using now are effective against all of them.
Yep.
But we don't know, if, I think they anticipate that the the British variant is going to be the dominant virus, come springtime. But I mean, it's interesting to participate in epidemiology, in disease treatment, prevention, and all at once. I mean, what we've seen in the last year, and we're almost a year to the date, when COVID entered Vermont, and it's just absolutely amazing what we've seen related to understanding of this pandemic and the science behind the pandemic and the rollout of the vaccines. And, we're trying to still come up with ways to treat it. It's absolutely, amazing. I was interested, like when we first got hit at Burlington Health and Rehab, I was the first, I've been a medical director at Burlington Health and Rehab, the long-term care subacute rehab facility on Pearl Street. And we were the first facility in New England to have COVID. And it was like, what do I do? And it was like cowboy medicine. I mean, Dr. Levine and the cowboy med, and everybody got hydroxychloroquine, and, but I was reading with interest that there was some report out of Russia, related to a particular type of oxygen delivery for these people to keep them out of the intensive care unit. And they were talking about the standard care. They were delivered the standard care inclusive of dexamethasone, hydroxychloroquine, and then this thing. And so they're still using hydroxychloroquine as standard care in individuals in Russia who, but there's not an answer to that. Is this going to be are we going to get a flu shot? Are we going to get an influenza COVID combo every year?
Right.
Are we going to treat, right now, influenza vaccines are quadrivalent. In other words, there's 4 different strains of viruses at vaccine. And so are we going to play the guessing game with COVID? Okay, what's going to be the dominant, strain of this virus coming down the road? And, the infectious disease and the virologists and the think tanks, but right now we know we have protection to develop some type of massive immunity to try, because we're already suggesting that this downturn we've seen in the last 4 weeks has nothing to do with the vaccine. It has to do with the developing of herd immunity from the general population.
Wow, interesting.